The patient here progressed within 11 months after sorafenib, which is not really a surprising event, but at the same time, it's not a discouraging event. Usually, the median time on sorafenib is about 5 months or so, so 11 months is totally appropriate and reasonable. The good news is that this patient really had a very good tolerance of the sorafenib, did not require those adjustments with the grade 1 head-foot syndrome and grade 1 hypertension, as we mentioned. And as such, if anything, based on the recent data and the approval of regorafenib, a patient is eligible for regorafenib as a standard of care second line after failing sorafenib. Regorafenib is a quite intriguing drug because it really came out of the blue with very positive results after progression of sorafenib. To debrief everybody what the story was, patients who were on sorafenib really progressed. They really had a clear progression of disease. They did not tolerate sorafenib. They really progressed on sorafenib, were offered sorafenib versus regorafenib correction versus placebo. Patients on regorafenib had median survival close to about 10.5 months in second line compared to the placebo close to about 7.5 months. So clearly there is a evident progression of disease and followed by a control of the cancer one more time with an improvement in survival. Very important several facts over here. Number one is, surprisingly, but at the same time nicely, patients were able to have a response rate on the regorafenib after sorafenib. We know it's a real story. Number two is, some people wonder maybe patient did not receive enough sorafenib, maybe a little bit of sorafenib followed by regorafenib. Interestingly, in this study, which is now published in the Lancet Journal, it appears to be that the median time on sorafenib was about 7 months. So it's a real experience with sorafenib, same like our patient over here today. Add to this, the time between the sorafenib and the regorafenib was actually allowed to be a certain period of time in the clinical trial, and people were wondering if maybe the trial super selected for patients who are having rather a good prognostic outcome. Well, surprisingly, they only were off the sorafenib and starting the regorafenib within median of 28 days. So clearly, this is a real story about people who received sorafenib, progressed on it, and then ultimately received regorafenib. An important fact, which actually was mentioned in one of the presentations by Dr. Bruce, who is the first author on the regorafenib study at the ILCA meeting in Vancouver in September 2016, in an unplanned analysis, the additional or the additive effect of the sorafenib followed by regorafenib in regard to median survival is or will lead to a cumulative median survival of 26 months. That's unheard of before. Remember, back before 2007, we were talking about 6 months. We moved to about 10 months with the sorafenib, and now we're talking about 2 years plus in regard to median survival. So clearly, this is a clearly important story, and by all means, I can see the patient here with the approval of the drug now and the tolerance of the sorafenib beforehand, they appropriately so should be on regorafenib.